Hi, my name is Karen Santiago, and today I will be discussing a significant public health issue, which is tobacco addiction. This case study highlights the challenges, economic and social factors, and potential solutions for addressing nicotine dependence. Tobacco use remains one of the leading causes of preventable death, even though it has declined over the years. And understanding it is important for implementing effective interventions. So, getting into the background and why the problem exists, addiction is a widespread issue affecting individuals across all demographics. Nicotine addiction, in particular, has devastating health consequences such as lung cancer and cardiovascular diseases. Secondhand smoke also harms non-smokers, especially children, leading to a condition like asthma and ear infections. The root of tobacco addiction lies in brain chemistry. So, nicotine stimulates dopamine releases, which reinforces dependence and which makes quitting extremely difficult. Early exposure, peer pressure, and misleading marketing further contributes to addiction. Many individuals begin using tobacco products before the age of 18 after believing that alternatives like vaping are safer options. Some demographic and economical factors are that tobacco addiction is prevalent across different age groups, with 1 in 13 adults in the US struggling with alcohol or tobacco addiction. The economic burden is substantial, with alcohol abuse alone costing the US over $98 billion in 1990. Tobacco-related healthcare expenses and reduced workforce productivity add to these costs. Crime rates also rise due to drug-related activities. The black market for tobacco products complicates regulation efforts, making enforcement way more challenging. Furthermore, public perception and cultural acceptance of smoking hinder prevention and intervention efforts. Moving on to our SWOT analysis. SWOT stands for strengths, weaknesses, opportunities, and threats. So, getting into the strengths, government regulations and public health campaigns have helped reduce tobacco use, which is good. Banning smoking in public places, and increasing the legal purchasing age to 21 are effective measures. Moving on to weaknesses, nicotine addiction has high relapse rate, making long-term solutions difficult. Treatment options can be expensive or inaccessible due to low-income populations. Opportunities. Some opportunities are advances in neuroscience and addiction treatment, which provide new intervention strategies. Public awareness campaigns and school-based education programs can prevent early addiction. Lastly, some threats. The like I mentioned before, the illegal tobacco trade complicates enforcement, shifting public opinions and inconsistent policies, creating challenges in addressing addiction effectively. Moving on to some solutions. To tackle nicotine addiction, we must enhance smoking cessation programs and policy. So, like in this slide, we're going to look at the root causes before we get into the solutions. Like I was talking about before, we do have nicotine addiction dependence, which can influence major things like your behavior, mood, and emotions, and it can even cause mood swings. Nicotine addiction is intense once you go into withdrawal, which is hard because the brain releases dopamine, which encourages ongoing tobacco use. Um, there is a misconception that tobacco is less healthy or than nicotine. That's why some people tend to go to nicotine, but they evidently lead to the same thing. And then early exposure and social influences. For example, teenagers fall into peer pressure, which affects them later on in the long run. And once they start using these drugs, they rely on it to keep them with the same effects. And once they get away from this, withdrawal symptoms are irritability, anxiety, and trouble sleeping, making quitting tough. Now, on to possible solutions. To tackle nicotine addiction, we must enhance smoking cessation programs and policies. Key initiatives include increasing access to smoking cessation resources, which means providing free or low-cost nicotine replacement therapies like patches and gums, along with behavioral counseling and supporting groups. Improving The second one could be improving tobacco control policies and public health awareness, which just means adding more, enforcing stricter advertising regulations, and implementing educational campaign in schools. Continue on. To do this, we could use the health belief model, and the perceived sustainability is to teach people about the risk and nicotine addiction related to diseases. Some perceived severity focuses on the serious long-term effects of tobacco use, like mentioned before, cancer and lung disease. Some benefits of this could be immediate and long-term benefits of quitting smoking. For example, your lung health will be better after quitting, and obviously there are going to be some barriers, which is could be some withdrawal symptoms, and providing easy access to quitting smoking resources will help this. Moving on, our last two recommendations would be increasing access to smoking cessation programs and supporting services, and lastly, improving tobacco control policies and youth prevention efforts. So, partnering with healthcare providers to integrate cessation programs into primary care can help encourage people to go to these programs to help them with their addiction. Launching public awareness campaigns using social media and community events can also help, since we're in a generation that our society uses social media to market, and it would be a good way to use our resources that way. And lastly, expanding access to NRTs through government subsidies. So the first thing, our action plan would be, like I said before, building partnerships with healthcare providers. This will help integrate smoking, all like I mentioned before, the clinics, hospitals, and community health centers. And people that would be responsible for this would be the public health agencies, local healthcare organizations, and policymakers. And as I showed here, there's a timeline. So this would be 1 to 3 months. And the second step would be to launch um, public awareness, like social media campaigns, and this would take about 2 to 6 months. The next step would be to expand other horizons and access nicotine replacement and offer up subsidies. And lastly, we would be able to break out of the cycle with the help of resources that are accessible for everyone. Tobacco addiction is a critical public health issue that requires a comprehensive approach. Learning from Portugal's decriminalization model, we can prioritize health-focused interventions over punitive measures by enhancing prevention efforts, improving accessibility to cessation resources, and enforcing stricter policies. We can reduce nicotine dependence and improve public health outcomes. Thank you for your time, and I welcome any feedback. Here are my resources.